Okay, so today I'm going to talk about canine bladder stones, and I know this is kind of a repetitive topic. A lot of people have covered it, but I did it due to my personal experience with it. So bladder stone formation occurs when a bunch of minerals and sometimes other materials aggregate and then basically fossilize in the bladder or sometimes in the urinary tract, sometimes even farther up in the kidneys, and it starts to cause some problems. Dogs can have one or multiple stones, and they can range from microscopic in size to over 4 inches in diameter, which essentially takes up the entire bladder. And so for size reference here, this is inches on this ruler, and this one here is only about 1 inch in diameter, so they can be about 4 times as big as this, which is enormous. And then here is an x-ray pointing out multiple bladder stones. And the thing that I found most interesting is that 85% of stone patients are young females. I'm not sure why necessarily they're the most predisposition to it, but that's what all of my research found. Another reason could be just genetic predisposition in general, abnormal urine pH, your diet, or a lot of times a UTI will actually cause the formation of struvite stones. And some breeds that are genetically predisposed to it are toy breeds, but also for whatever reason Labrador retrievers and Dalmatians are in that group. So there are 4 different types of bladder stones. The most common is struvite. It's a compound of magnesium, ammonium, and phosphate, and they're typically like smoother structures. They're these white ones down here that I showed on the previous slide. They're the ones I'll focus on. Another one is calcium oxalate, and this is typically due to your body's either inability or improper digestion of calcium, or there might be excess in the urine, or there might be excess oxalate. The urate or uric acid stones is protein breakdown basically gone wrong in the body, and so it forms stones in the bladder. And then very rare, but there are these cystine crystals, and it's less than 1% of stone cases in dogs, but it's due to a genetic condition. So symptoms and diagnosis, a lot of dogs you'll see they're having urinary accidents. They could be the most well house-trained dog that there is, and they're still going to pee in the house. They're going to want to go outside about every hour on the hour, and then they're going to urinate a very minimal amount, and it's going to continue to happen like that. Instead of having like one large urination, it's going to be very frequent small urinations. They're going to strain when they urinate. They might have discolored urine or blood in the urine, and they're probably going to lick around the urinary opening. There's a lot of different ways that you can diagnose it, and depending on how severe the animal is when it's brought in, the vet can order multiple different tests. A lot of times the urinalysis or urine culture is used to determine if there's a UTI, which again can incite the creation of struvite stones. Chemical tests to see how their other organs are functioning. CBC is a complete blood count to see if there's an infection as well. An electrolyte test to make sure that they're hydrated and it's not an issue with dehydration. Thyroid test to make sure that all the hormone levels are right. X-ray, which is going to show you stones like this. Or an ultrasound, so anybody who does any kind of reproductive work, ultrasound, you want to see black is fluid, anything white, which is typically when you're looking for a fetus, but here you can see there's a big bladder stone sitting in this bladder. And you can see the walls of the bladder very easily because it is filled with fluid as well. And then if the animal has already passed a stone and you were able to recover it, they'll actually run stone analysis to see what kind of stones your dog has to determine what kind of treatment to do. So treatment, there can be fluid therapy that's going to facilitate the passing of small stones. It's essentially just an overload of fluids into your body system to cause the dog to flush. You can medicate in the event of a UTI with an antibiotic. If it's very severe, they can do pain medication to help reduce that pain until the stones are either removed or flushed. Surgery is really typical, especially if the stones are large, and a prescription diet after the surgery or treatment to prevent future stones is almost always a given. So the reason I did this is because my dog Taters, he was actually a 7.5-year-old male when he got his stones, which I thought was kind of odd. He's still intact, so I don't know if that played a part in it or not. But I've had him since he was 8 weeks old. We've never had any kind of medical problems, and I came home my freshman year of college for fall break, and he was having accidents in the house, and he was straining to urinate, and my dad had been like griping about it for some time, but like dads don't want to go to doctors and things, and so my dog didn't need to go to the doctor. And so I took him because I actually worked at the vet clinic at home, and he actually had a very, very, very severe case. He had a UTI, he had very large struvite stones, multiple, and it was to the point that he had tried to pass a stone. It was lodged in the urethra, which worsened the infection, the stones, and he couldn't relieve himself, so his bladder actually ruptured into his abdomen, and he had a 24-hour prognosis if he didn't have emergency surgery. So we went in, I say we because I was actually part of the surgery. We went in, cut open his abdomen, drained all the fluid, got the stones out of his bladder, repaired his bladder. We actually had to run a catheter through his urethra and get the stone that was lodged in and out, and then he was on fluids, antibiotics, the whole 9 yards until he was better, and then he's actually still 2 years later on the preventative diet because we don't want to go through that again. And so this actually isn't my dog. I didn't think to take a picture of his surgery incision or scar. This is actually a young female, and you can see here they just make a vertical incision on the abdomen. They go and get the stuff out of the bladder and patch it up. It doesn't take very long to heal. When you do have this surgery though, they always recommend keeping the dog out or making sure they're able to use the bathroom frequently, because if you keep them crated for more than 4 hours at a time, there's a chance that they'll rupture that suture, and then you have to go in and do repair and whatnot. And this is the food my dog is on. There are other brands, but they make specific urinary diet ones that are high fat, high sodium. They particularly encourage water intake so that they're making sure nothing is sitting in that bladder and starting to form another stone. And those are my sources.
Let's give her a round of applause. Excellent. Questions, comments about bladder stones, kidney stones? There's one way back. I'll let you talk.
So the dog food that you showed us that half live, is that a prescription only food, or are there like non-prescription preventative foods for kidney stones?
Repeat the question.
Yeah, so the question was the food that I showed, was it a prescription food, and can you get non-prescription foods for urinary issues? The one I showed is a prescription food. I have a prescription from my vet, and to my knowledge, there's not one you can get without a prescription. You can get them, you can purchase them through a vet clinic, but typically the vet has to see the dog first and make sure that that's the diet that they need, because it is very specific and it can cause problems if they have any kind of other organ issues. So they have to be checked out before they can be put on it.
There's one.
You said the stone was lodged in the urethra, and I know you said you repaired the bladder, but did they have to go in the urethra and remove it, or?
Yeah, we ran a catheter through it and got the stone out because
So
males
you
are
push
at
it back up into the bladder.
Yes, we ran a catheter, pushed it back up into the bladder, and went into the bladder and got it out that way. Males are at a higher risk as far as stones go because their urethral opening is smaller than a female's, so when they try to pass, a lot of times they will lodge. And it's not always common that it blocks the entire opening, but his was a large stone, and so it had been, we don't know for how long, but it had been completely blocked off, and all of that pressure had built until his flat bladder finally ruptured.
Yeah, I have a question on that. What did it look like? Did you see the rupture? You know what I mean?
Yeah, so it was right on the wall of the bladder, and it basically just looked like kind of anything you would expect, like a balloon when it's popped under pressure, or a water balloon, like how it's not a clean tear, it's not,
Right.
like
So
very
how-
small. It
I'm
was a
trying to
pretty
get a
large.
picture. How
His
long?
was almost across his entire bladder
Oh,
wall on
wow.
one side. I mean, he had a lot of fluid in there, and
I
we
mean,
didn't,
that's where they
but
set up peritonitis.
it was kind of, yeah, it was kind of confusing because he was still letting a little bit of urine through when he was urinating, and he was wanting to go out constantly, and so it was.
Maybe, was it more seeping then? You know,
Yeah,
rather
we
than a
think
pop-
it wasn't actually urine coming out. It might have been some more of the infection, because he had a severe infection in there as well.
Okay.
He had a lot going on.
Okay. There's another question.
Did you notice any like secondary symptoms that could have been from like the rupture of his bladder that like you didn't mention before that are just like specifically from a UTI or a kidney stone?
So I struggle with this a little bit because I came home that day and he was in the vet and having surgery. Yeah, like by the time I was home, he was at the doctor.
Yeah.
But the only thing I can think of is he was kind of a little, like, if you tried to pick him up, he was kind of sore, like, didn't really want to be handled, especially in the abdominal area, but I would have never in a million years guessed that his bladder had ruptured.
Yeah. Now, so I'm back to the rupture because I'm trying to picture this. So it was more like a tear or something. So did they have to suture the bladder a long line or not?
Yes. Yes, he has
Okay.
so after we put the catheter through, he had all the stones. We went in and basically just already used the rupture area, got the stones out, and then sutured him up entirely.
Okay. I just wanted to cut this off. There you go. I hate linear objects. There you go. Okay, great.